I had someone ask me about trauma and different practices for trauma, which is obviously a big subject. But this is like not acute trauma, but results of traumatic events, PTSD and trauma-based issues. Anyway, they were asking about yoga nidra and versus other kinds of contemplative practices. Sort of asking me whether yoga nidra would be a good intervention because there's been so much studies on PTSD with the IRIS things, and we're actually talking about that at the retreat, so it's on my mind. But the basic thing is that with trauma, you get, many things can happen, but you get dysregulated, and so your responses, your nervous system response is different, fight or flight is different. And I thought I'd just give a 2-minute explanation of the yoga nidra rationale. So yoga nidra can go either way depending on how you apply it, but if you can keep the person safe, IRIS has a pretty nice protocol for, they have something called the inner resource, but basically like finding your safe place, the safe set of images, being an environment also that feels safe to you, or as safe as it can. The rationale with the yoga nidra practices from a scientific point of view is that it changes brainwave states. And so you can imagine someone with trauma has become dysregulated and they're not going through the brain, without talking about brainwaves for the next half hour, which I could, I'm interested in it, but the brainwave states get shifted, and so yoga nidra re-regulates them and furthermore sort of promotes certain types of brainwave states that have people be more calm, but more importantly, allow them to think more broadly. So often these brainwave states are associated with creative endeavors. But when it comes to trauma, it's sort of similar in that, or applicable, I should say, in that you would need those brainwave states in order to think outside your current situation, which is responding to the trauma. Another way to look at it is it allows you to be more in the present. But I think maybe a better way to think of it for us would be, you have somebody who's just sort of constantly getting input from sort of memory, right, and things that trigger memory. And then what you would want is for their brain to be more malleable. So yoga nidra would do that. It's not really different than meditation for that. Both of them, you could argue that they're the same. I think what's interesting about yoga nidra protocols, which are all guided, often lying down, and use the body's natural ability to go to sleep, but you're sort of sleeping while awake. So when you're sleeping, you get all these beneficial brainwave states, but when you're awake, you get them, but you can sort of guide your experience. And so instead of just sleeping and dreaming, et cetera, you can sort of promote these brainwave states that would make you more likely to see things in a broader perspective, be less sort of triggered by things around you, and therefore change your response to a traumatic event. So yoga nidra, to answer the question, is like, is this good versus like mindfulness meditation? I don't know that I want to go on the record to say, not that anybody else is listening, but saying that one is better than the other, because there's plenty of reasons to think meditation is a good idea, plenty of reasons to think yoga nidra is a good idea, there's plenty of reasons to think pranayama is a good idea. But yoga nidra is particularly good at getting people who don't have a high skill level into these states. So that's why it's a particularly good intervention. You'll hear me on the Q&As and talking about cases recommending yoga nidra over and over again. And that is because you would need to be personally less skilled to go into like sort of deeper states. Whereas with meditation, you would need a lot more training. So most people would find that, it might take them 12 weeks or 16 weeks, right, to get their sort of meditation, let's say mindfulness practice together where their brain's really changing. Whereas with yoga nidra, in just a few sessions, you can gain a lot of skills. So that's the advantage. On the other side, there isn't really an advantage because I think, you know, once you do have the skills, I'm not sure one's better than the other, and they're different in their nature. Another point, I guess we could talk about all the different ways they're different, but if you have someone sort of off the street, I have these responses that I don't like to past trauma. Someone said you could help me. I'm super agitated all the time. Yoga nidra would be a go-to because you could say to yourself, okay, one session or maybe 2 sessions or maybe 3 sessions, I can get this person to experience these states. And that's the, for lack of a better word, that's the sell of the whole thing, because you need to have like an experience in order to want to do it again. So people can only go on faith so long. So yoga nidra gives you that quickly. And now there's some great research sort of verifying all this. So that's good, but even that research is still in its infant. So just to answer that question, so you know, yoga nidra is particularly good for trauma. The only caveat is has to be done correctly, has to be done with somebody in a very sort of safe space, so they need to have some sort of out or technique when difficult emotions and feelings arise. You can't just tell them to write it out, because if they've experienced strong trauma, that might be very unsettling and difficult for them. So that would be the